watch this before starting HRT therapy. Hi, welcome back to Angelic Live Wellness. I'm Dr. 𝐦𝐤𝐤𝐿, and today we want to talk about 5 things that you need to know before you start HRT therapy. These 5 things are actually the things that a lot of my patients want to get answers for before they start therapy. And they are the most common questions that I get about hormone replacement. Why should I go on hormone replacement when everything I've heard about hormones are kind of negative? And we want to kind of talk about these 5 things today to try to see if after hearing them, maybe you might still be interested in getting your hormones replaced or not, okay? But you definitely want to get these answers first. All right, so the first one is hormone replacement therapy going to give me cancer? Okay, that is the #1 thing on most people's mind. Okay, I want you to put it in the section below. When you hear hormones, tell me if you constantly or immediately think about cancer, okay? That is the #1 thing patients want to know. Is it going to cause cancer? Because when most women and men heard about hormone therapy was around the year 2000 when the study came out about Women's Health Initiative, and that study was very negative as far as the conclusions. The conclusions that they had was that patients that were put on this synthetic hormones or the hormones from the pregnant mares, basically urine of pregnant horses, they extracted hormones out of it and gave this to post-menopausal women and some women that were kind of perimenopausal. And the result came back saying that there was increased risk of heart disease, of strokes, of blood clots, and of various types of cancers. And from that study, a lot of doctors shied away from prescribing hormones, and a lot of women that were on hormone replacement therapy at the time immediately came off or were weaned off thereafter. And since then, the minute someone mentions hormone therapy, immediately everybody thinks cancer. Okay, is this true? Is this really the answer or the conclusion that should have come out of that study? Now, there's been a lot of debate about people going back to really look at the data and look at the study design, look at the biases, look at really the conclusions that were drawn about this study. And you can just type that into Google and see a lot of conclusions about this. But here is what that study was missing, right? Usually when we're designing a study, we look at the placebo, which is basically the patients that are not taking anything, right? And then we compare it to the drug that they are trying to take. But if there is a current treatment that patients are using to deal with that condition or address that condition, there should be a third arm on the study that puts the patients on the current treatment, placebo, and then the new drug. So one of the main problems that we see with the Women's Health Initiative was that this study was designed without that third arm. Because that third arm should have had patients that were using natural hormones to basically balance their hormones, right? People using things like progesterone cream that came from wild yams. People using estradiol, which is the natural estrogen that we get from plant source. Or using testosterone that we extract from, wild yams or from soy. So those should have been included in that study as a third arm for us to compare and see what kind of results that we get when we look at these 3 groups. Well, that was not included in the study, the natural arm. So we just had the synthetic drugs, which was progestins, which is not the same as progesterone that our own body makes. It's similar, but it's not the same, right? And then we looked at some Premarin, which is again what we talked about, which is the hormones from pregnant horses, okay? So when we compare this study, then yes, it did show that there was some increased risk of cancers, and so from that comes the fear that a lot of patients have. The minute you mention hormone replacement therapy, they immediately think, oh God, that's cancer, right? But it's not necessarily true, because if you think about it, as we're growing up, right, we're aging, we go through puberty, which is when we have the highest surge of hormones in our bodies, right? And if hormones really do cause cancer, then the group of people that we should see the highest amount of cancers in is in patients going through puberty. But we don't see this, right? And in fact, they have the lowest risk of cancers if we look at the studies or the statistics. So how can we explain that hormones in itself, especially in its natural state, as is made in the body with no additional chemical structures on the molecular structure of these hormones, how can we say that this causes cancer, okay? Well, there are definitely a lot of factors that play into why patients develop cancer. We know that there's a lot of DNA damage, there's a lot of free radicals, there's a lot of toxins in the body, there's a host of things that can lead to cancer. And just blaming it on hormones, especially natural hormones, is a conclusion that is very, very dangerous, especially because hormones are very powerful and the number of things that they help do in our body we cannot ignore, okay? So that is one of the areas that most people are worried about, and we really need to go back and look at, is that true? Is that conclusion from that study really something we should be concerned about, or is it something that we need to just say, wait, what type of hormones am I using, and is that one to worry about? Okay, so the next thing I usually hear and that most people are worried about before starting hormone therapy is weight gain. So a lot of women and a lot of men, you know, that have been on hormone replacement therapy sometimes would mention that they noticed weight gain. Well, here's the concern. When you weigh yourself on a regular scale, well, it doesn't tell you what you've gained. Have you gained water? Have you gained muscle? Or have you gained fat? So when people start replacing their hormones and they notice some weight gain on the scale, what we want to figure out is, what is it that you actually gained, right? So one of the things that I use in my practice is a body composition analysis, right? A bioimpedance machine, which actually measures the actual tissue so that we can figure out what is it that this patient has gained. And a lot of times what we notice is muscle gain, right? So muscle gain, in fact, the studies are showing that muscle gain is very, very good for longevity. So when a patient replaces their hormones and is completely balanced, where they have good balance between all of the different sex hormones and metabolic hormones, we tend to see an increase in muscle mass, especially in a patient that is eating right and exercising. Well, this is good. This is good weight. This is the type of weight that we do want, because it does prolong life when we have more muscle mass. But if you are gaining weight and you feel like it's fat gain, well, one of the things that we also have to look at is, when you start balancing your hormones, are you eating wrong? Are you still drinking a lot of alcohol? Are you still drinking, and eating a lot of sugary foods and a high carbohydrate that's highly processed, right? Well, if you're doing those things, yes, you're going to gain weight, and it has nothing to do with the fact that you are on hormone replacement. It just means that your lifestyle had not changed, and so you are going to gain weight regardless. So let's talk about really the weight gain that you're seeing. Is it good weight or is it bad weight? And the only way to know is to use a body composition analysis machine to get that answer, right? We can also do a DEXA scan, which is of course a little bit more, expensive and more cumbersome to try to get one of those done. But you can definitely use a bioimpedance machine, which is a lot more cost effective You can buy versions that you can keep in your own home and check and see how your weight is doing, okay? So another thing that you definitely want to know before you start hormone replacement therapy is, does this really cause, cardiovascular issues? So there are some studies that, especially there was a particular study that was done with the VA or the Veterans Administration, and it showed that, we should be careful about replacing the testosterone in, this patient base, because there was some suggestion that maybe the testosterone was causing increase in the risk of cardiovascular disease and things like that. But one of the things that we actually found out by looking a little bit further into that study was that the study design, again, just like in the Women's Health Initiative, included patients that were already at risk of having cardiovascular disease. These patients, a lot of them were diabetic, a lot of them had, high blood pressure, and a lot of things that increases their risk for cardiovascular disease in the first place. So yes, when you give these patients testosterone, and it actually is supposed to help decrease their risk, right? Because we find out that patients that don't have enough testosterone are actually at increased risk of heart disease. So we definitely want to look at the population that we're looking at and what hormones that we're giving them. Are we giving them with other pre-existing conditions, other comorbidities and things like that, right? Because that's what really determines the benefit and the risk. And so for everyone that is going through hormone replacement therapy, we really have to weigh those and balance them and figure out which one is which, right? Is this patient more at risk of actually getting hormone replacement, or is this going to be more beneficial to them? Also, we see concerns about blood clots, and in women and in men, we can see blood clots even without hormone replacement, because there are other risk factors for having blood clots, right? So having, being involved in a recent prolonged surgery, being in a travel that's had you sitting for several hours or immobile for several hours, those are things that can also increase your risk for blood clots, and not necessarily hormone therapy in itself. And some people have some genetic predisposition to having blood clots that we don't routinely test for, right? So just because somebody started hormone replacement therapy and then they had the blood clot, doesn't necessarily mean the hormone replacement therapy in itself is what caused the blood clot. It might just mean that they were already at risk, and now the environment just makes it even more possible for the blood clot to show up. Okay, so other things to think about, and other questions that I typically get is about long-term effects, or how long am I going to have to be on this therapy? And that is one reason why a lot of people don't even start. I mean, I have patients that ask me all the time, okay, well, I understand what you're saying. I understand that, this is going to be beneficial in, a lot of different aspects of my life, but how long am I going to be on this for, right? And this can actually be a reason why most people need to decide whether they're going to go on hormone therapy or not. Because this is how I answer it to my patients. I say, look, how are you feeling right now? Well, maybe not so great, right? That's why we're here. That's why we're talking about, replacing your hormones. Well, when would you like to return to feeling that way? Because once we get your hormones balanced and you're feeling better and you're sleeping better, your energy is better, and you're building muscle and you're burning fat, and you're having less joint aches and pains, and no more hot flashes, and no more night sweats, and you have motivation to go work out, and you're recovering from your exercise better. Well, when do you want to stop feeling all that? Right? So I tell patients, like, yes, hormone replacement therapy is something that we probably will have to continue to do for a long, long, long time. Because as long as you want to stay healthy, as long as you want to be around and be functional and have good memory and not develop dementia and osteoporosis and bone fractures, you need to replace hormones, because they are going to help you in that quest, right? So asking whether, how long am I going to be on this for? Is it going to be for a couple of months, 6 months, a year? No, hormone replacement therapy, we are replacing what therapeutically you need to have optimal health. So we don't plan to take you off of hormone therapy because why? It is what your body needs to be functioning optimally. There is a school of thought of people that believe, well, why don't you just let nature take its course, right? Why don't we just let the natural course of things just happen, right? If our body is meant to dwindle, then let it dwindle. Well, those same people should also answer this question. Lifespan used to be 45, 50 years. Why don't we just not intervene and just let everybody die off, right? No, we don't. We want to live here. We want to see our grandkids. We want to see our great-grandkids. Science has advanced in such a way that we are able to live longer and healthier, and we should take advantage of that and balance all the hormones that was needed prior to us turning 40 and 50, and make sure that we optimize it as we go into our 60s, 70s, 80s, 90s, and some hundreds, right? So we want to be here, we want to be functional, we don't want to just be here and then be in a nursing home, right? We want to be here, be functional, have good memory, be able to recognize our grandkids and our great-grandkids and spend fun, enjoyable time with them, right? And we want to be able to get around, be able to visit our friends, travel, do different things. Well, we need hormones to do all that, and that's the point. So how long am I going to be on hormone is usually the question I get, and my answer is for as long as you want to feel optimal, okay? So the last thing is, how does this impact fertility? And I get this from, especially for patients that we start to notice hormone imbalance in a very young age. Maybe they're still not quite, that perimenopausal or periandropause age. And so they are concerned about, okay, what if I want to have more kids? Some men, maybe marry late, and so they want to still have kids. And so they're wondering, well, if I start replacing testosterone at this age, is it going to stop me from being able to be fertile? And same thing with women. They were wondering if, well, I started my career, very early, and now I had to push my child rearing years later. So I want to make sure that, this hormone replacement therapy is not going to stop my fertility and the ability to have kids if I want to have some in my 40s. Well, so the truth is, fertility is something that there's a lot of factors that is playing a role, right? There is, the fact of how is your diet been? How well are you handling stress? What kind of toxins has your body been exposed to? Genetically, do you have the eggs, to be able to actually have that baby? There is also, for the guys, are your testes still able to produce sperm? And, so there's all these other factors that we also have to look at, and it's not necessarily just the hormone balancing itself. So we can balance hormones, and you do need balanced hormones to be able to have kids, but we have to have this conversation about what type of hormone replacement do we look at if you're still trying to have kids in the next few years. What options should we use? Should we be using something that promotes your whole body's way of making more hormones, or should we actually replace the hormones? So those are all things that we have to weigh and balance for each patient for us to really figure out which is the best option. So I hope those have been helpful for you guys, especially if you're considering looking or starting hormone replacement therapy, because these are the most common questions that I get in the clinic about whether I should start, should I be scared, should I be optimistic, should I be excited, and it sometimes stops patients from moving forward by not asking these questions. So I thought I'd throw it out here, see what you guys think. If there are any other questions that you guys think about or worry about in terms of starting hormone replacement therapy, even though you have been told you need it, your blood work is showing that you're deficient, please put it in the comment section below. I would love to make other videos and answer those questions if I've not already answered them here. Thank you for watching, and I'll see you on the next one.